Hi everyone, Dr. Arielostat, cosmetic dermatologist. One of the topics that keeps recurring in my conversation with my amazing patients who've had skin cancer are what are the things they can do to prevent future skin cancer. And unfortunately, the way medicine works right now, it's about really treating the symptoms and not being proactive. And as new pre-cancers show up or skin cancers, we kind of go ahead and treat them. But I think it's so important to sort of take medicine to another level of being proactive and taking proactive measures in terms of reducing pre-cancers and reducing skin cancers in the future. So let's just go through that. And this is a conversation I have on a daily basis multiple times with my patients who've unfortunately experienced skin cancer. So number one, lifestyle matters. And the steps you can take with regards to improving your lifestyle is obviously wearing your sunscreen, using a mineral-based sunscreen, staying out of the sun as much as possible. It's important to get that vitamin D, but maybe we can do that early in the morning or sort of after 4 o'clock. So sunscreen use, regular use of it every 2 to 3 hours, wearing a wide brim hat or wearing a cap to cover your scalp. That's kind of the basics. But your lifestyle also matters. And what I mean by that is making sure you get 6 to 8 hours of sleep. I know it's hard to incorporate that, but at least 6 hours of sleep. Sleep has been shown to really help, increase our immunity, and it's really boosting our immunity that allows our immune system to fight off those mutations and the sun damage. Sleep matters, our diet matters, really reducing oxidative stress, we call it, on our body, and that can happen with anything that's inflammatory. So you want to make sure you avoid a high-fat diet. You want to make sure you sort of increase vegetables and fruits in our diet, and that has been shown to eating sort of green leafy vegetables, multicolored vegetables, that has an incredible ability of boosting our immunity, getting rid of inflammation, reducing oxidative stress. Lastly, it's stress. Stress is a huge factor that makes our body inflamed. It lowers our immune system. We all unfortunately deal with stress, but it is important to find measures to reduce stress, whether it's through exercise, whether it's through meditation, whether it's through being around loved ones. So those are basic lifestyle. Let's talk about now what can we do with regards to just incorporating certain things that have been shown to actually reduce the incidence of pre-cancer and skin cancer. One important thing is the molecule niacinamide. Niacinamide is vitamin B3. There are a lot of peer-reviewed journal articles that show that actually niacinamide at the appropriate dose of 500 milligrams taken twice a day gives the ability to our body, for our body to repair itself. It specifically gives energy to our mitochondria, which are these organelles within our cell that actually produce ATP or energy, and that actually helps boost the cell's ability to repair itself and repair DNA damage. So I always tell my patients to take niacinamide. I tell them to apply niacinamide topically. Those are two important things that can be done. And lastly, there are procedures that can be done in the office. They range from what we call photodynamic therapy to lasers, to even topical creams, specifically what we call 5-FU or imiquimod, that can actually help catch those sun damaged cells below the skin. Hopefully this helps. Thank you so much.